Now, Dr. Pittaway, let me ask you a question. There is some rumors out there which I have heard, and they may not be rumors, and that is when you have, let's explain the difference between dentures and implants, and let's explain how that applies to the cosmetic look, basically to the outer appearance of the face of the person. What is happening? What will happening with one or the other one to a very high degree? What does that do to, how good will I be looking in 10 years if I put in dentures versus if I put in implant?
Well, Helmut, that's a very good question. The appearance is greatly affected by the teeth, and that's clear, of course, when people start to lose teeth. We all know that's not attractive, and when they lose all their teeth, that's a big handicap. Now, when you have replaced your teeth with dentures and you have your lip support back, you can actually start off looking pretty good. The problem with regular dentures over time is the breakdown of the bone supporting the dentures is a slow and continuous process. And what I find in many patients is that as the bone breaks down and the teeth wear down, you start to get creases in the cheeks, wrinkles, the chin gets closer to the nose, the jaw creeps forward a little bit, and the appearance of the person actually begins to age before your very eyes. And proper restoration with the dental implants, perhaps even supporting the dentures or even a full implant-supported set of teeth, pretty much eliminates this problem because it protects the bone from breaking down. The teeth are supported not by the bone, which is always changing, but by the implants. And when that happens, the bone's protected from a lot of the stress of the denture. So those teeth, they stay better looking. They support the face better. You don't get the wrinkles, the aging, the collapse of the facial structures, the creases. So long term, it's good for many reasons.
Wow. So basically what you're telling me, once your bones start shrinking, which they will start shrinking once you lose teeth, one or two teeth will shrink a lot less than all teeth, obviously. It depends on how many teeth you have lost. Your bones start shrinking over time because I guess they're not used or something like that, right? And when that happens, your face starts caving in and you start looking like a dried out tomato and, basically you start looking ugly. I mean, anybody who looks 15 years or 10 years ugly, older than he is, in layman language, it's called ugly. And nobody wants that. Is that what you're saying? You start looking ugly if your teeth are lost and if they are not at least artificially replaced with an implant?
Well, sure. I would probably not use the word ugly myself, but decreased attractiveness does occur.
A diplomat. Are you sure you're a dentist and not a politician? All right.
Oh, yeah.
I got it.
I'm sure.
Yeah, all right. Good for you. So, good. Decreased attractiveness. The fact is nobody wants that. Now, it's a question. It is nevertheless a money a situation in many cases. I mean, economy, for instance, right now just isn't quite as good. Most of us can't go to a home mortgage anymore because the house is on the water already and all that stuff. Now, a patient is faced with the choice implants and preserve the attractiveness, and I call it just simply don't get ugly over the next 10 years, or implants, dentures are lots cheaper, but get ugly. And let's say he has to go for the denture because the money just isn't here. Would it be wise for this chap, for this girl, to start saving up money so that within a year, 2, 3, whatever it might be, to be able to put a bunch of implants in it and then do the rest of it so that further deterioration of the ugliness, the bones is kind of like halted. Basically, is this an ongoing process? And if yes, ideally you replace it right away with an implant so that the bones not shrink. But if you must do the money, do it in 1, 2, or 3 years, that's still a lot better than never. Yes or no?
Oh, absolutely. How one of the beautiful things about implant dentistry is the flexibility with treatment over time. And so, sure, if you have to go straight to dentures and you can't afford a little bit extra for the implants, you know, they're definitely worth it. The value is there because of the benefits, you know, short-term and long-term. But, you know, I've had that happen with patients. We've been able to add implants in later on, even if we just put a couple under the lower denture with some special attachments. It makes a world of difference in their quality of life. Protects that lower jawbone, which is the most susceptible to collapse. And when that happens, of course, you get the facial changes and the wrinkles and the creases and the yeast infections in the corner of the mouth. But you know, definitely it's easy, usually, to add implants after you've had dentures. Now, if you've got a 20-year-old pair of dentures, you probably might consider replacing those dentures if you're going to do implants so that they work properly. But it's easy to do, yeah.
All right, good. So dentures is a prevention for not having a caved-in face, which we see in many old people, especially in the elder people, which are probably our parents, where that type of technology wasn't around. So wonderful. So if for some reason you can't afford implants now, go on a layaway plan.